Welcome to the School-Based Healthcare Services Training, Billing for Nursing and Health Services. This training is intended for nursing professionals who participate in the School-Based Healthcare Services program. In this training, we will take a look at which providers can participate in the SBHS program, which students are eligible to bill for, covered and non-covered services, how to bill for and document your services, and how to provide and bill for telemedicine services. Please note that a PDF of this training with active hyperlinks is available on the SBHS webpage at www.hca.wa.gov/SBHS. SBHS Program Overview. The School-Based Healthcare Services, or SBHS program, is an optional Medicaid program which provides reimbursement to contracted school districts, ESDs, charter, and tribal schools for providing medically necessary health-related services to Medicaid-eligible students who receive special education services per an IEP or an IFSP. This program allows school districts to receive reimbursement for services that they are already federally required to provide per the Individuals with Disabilities in Education Act. The SBHS program does not cover all of a school district's costs for providing special education and related services, but it can help supplement the district's budget. School districts can use their Medicaid funding to hire additional staff, purchase assistive technology, or pay for professional development. It is up to each district how they spend their Medicaid dollars. The SBHS program is administered by the Healthcare Authority, or HCA. HCA is the state Medicaid agency in Washington, and it is also the agency that manages the health benefits for state and school employees. The main contact for the SBHS program is the SBHS Program Manager. Any questions about the program should be directed to your district's SBHS coordinator or directly to HCA's SBHS Program Manager. Many parents and/or schools worry that if their school district participates in the SBHS program, this will somehow affect services that students may receive outside of the school. Please note that receiving services through the SBHS program will not affect services that students receive outside of school. Eligible providers. The following providers are eligible to participate in the SBHS program: Department of Health licensed registered nurses, Department of Health licensed practical nurses, DOH licensed advanced registered nurse practitioners, and non-licensed school staff practicing under the direction of either an RN or ARNP. Services provided by LPNs and non-licensed school staff must be delegated per an ARNP or RN per their scope of practice, and any services provided by LPNs and non-licensed school staff must be provided under the direction and supervision of either a licensed ARNP or RN. The requirements on this slide apply to Department of Health licensed nursing professionals. In order to participate in the SBHS program, ARNPs, RNs, and LPNs must hold active and unrestricted licensure with the Washington State Department of Health as a nursing professional. Licensed professionals who participate in the SBHS program must have a National Provider Identifier, or NPI, and must be enrolled as a servicing provider under the school district's Provider One account. As stated on a previous slide, LPNs must practice under the direction of a Department of Health licensed RN or ARNP. Provider One is Washington State's electronic Medicaid billing system. If you are a licensed ARNP, RN, or LPN, your district's SBHS Medicaid coordinator will need to collect information from you such as your Department of Health license number, your date of birth, Social Security number, etc., in order to enroll you as a servicing provider under the district's Provider One account. Billable services that you provide are then entered as claims by either the district's SBHS coordinator or the district's third-party biller. Although you will be enrolled as a provider in Provider One, you will not need access to the Provider One system, as you will document your services elsewhere. We will take a look at the documentation piece a little bit later on in this training. Non-licensed school staff providing services under the direction of an ARNP or RN do not need to be enrolled in Provider 1. Any services provided by non-licensed staff are billed under the Supervising Nurses NPI in Provider 1. When an ARNP or RN delegates tasks per their scope of practice to LPNs or non-licensed school staff, the non-licensed staff and LPNs are expected to keep detailed treatment notes of services provided and must have the supervising nurse review and co-sign all treatment notes. Any services provided by an LPN will be entered as a claim under the LPN's license number and NPI in Provider 1. Any services provided by non-licensed school staff will be submitted under the Supervising Nurse's License and NPI number in Provider 1. Supervision requirements for nursing services can be found on the Department of Health website, in DOH RCW 18.79, and in Department of Health WAC 246-840. Additional supervision requirements for school nursing services can be found on OSPI's website and in OSPI RCW 28A.210. In addition to DOH and OSPI supervision requirements, Medicaid requires that supervising providers review and sign off on any treatment notes kept by LPNs and non-licensed school staff. Eligible students. In order for a school district to receive reimbursement through the SBHS program, a student must have an IEP or IFSP with related services, the student must have active Medicaid coverage, and the district must have received parental or guardian consent prior to billing for services. Please note that school providers are not required to determine eligibility information. You should receive a list of eligible students from your district's SBHS Medicaid coordinator, or this information should be loaded into the documentation software provided by the district's third-party biller. If you are not sure if you should submit claims for a certain student, please contact your district's Medicaid coordinator. Typically, special education and related services are provided in the school setting. However, the SBHS program also provides reimbursement for services provided in the natural setting and in an alternate setting in accordance with the Individuals with Disabilities Education Act. If services are provided in a setting other than the school, providers must document this in their treatment notes so that the correct place of service can be entered in the claim in Provider 1. The SBHS program also reimburses for services provided through audiovisual and audio-only telemedicine platforms. Covered and non-covered services. The SBHS program provides reimbursement for IEP or IFSP evaluations and re-evaluations, as well as for the direct IEP or IFSP services, such as audiology, mental health, nursing, occupational, physical, and speech-language therapy services. On this slide, we can see some examples of covered IEP or IFSP nursing and health services. Please note this list is not exhaustive and is provided as an example only. Essentially, if the procedure is medically necessary and is prescribed by a physician or licensed provider, the service is more than likely reimbursable. Nursing professionals may contact HCA's SBHS program manager with questions regarding covered versus non-covered services. In order to receive Medicaid reimbursement for IEP or IFSP nursing and health services, the services must be ordered or prescribed by a licensed physician or other licensed healthcare provider within their scope of practice. ARNPs practicing in the school setting may evaluate, diagnose, and provide services without a script from an outside physician within their scope of practice. However, it is recommended that ARNPs review Department of Health regulations to ensure they are recommending and providing services per their scope of practice. If your district does not have an ARNP or physician on staff who can prescribe nursing or health services per an IEP, the district must have on file a physician's note or a referral from the student's primary doctor outlining the health services the student requires per the IEP or IFSP. The referral or note must justify the medical necessity for the services. Services provided by private duty nurses may be reimbursable through the SBHS program. In order to be reimbursable, nursing services must be written in the IEP or IFSP, must be provided by a Department of Health licensed ARNP, RN, or LPN who is enrolled as a servicing provider under the school district's Provider One account. The SBHS program only reimburses for direct one-on-one services provided to a student. The SBHS program does not pay for all-day observation of a child. In order to determine the reimbursement amount, private duty nurses must keep treatment notes for only the direct services provided to the student throughout the day. As a school-based provider, you are often multitasking and doing many things in addition to service delivery. There may be additional activities that nursing professionals provide on a daily basis. However, Medicaid will only pay for direct health-related services provided to a student. Services such as attending IEP meetings, observation of a student, parent consultation, and reviewing records are not Medicaid billable services. Many of these activities are already built into the rates assigned to each direct service code. It is very important to remember that when you are documenting the time spent with each student, you are only documenting and billing for the time spent providing direct services. Billing for services. In order to record what services you provide, the SBHS program utilizes procedure codes. If you've worked in a hospital or clinic setting, you know that all medical procedures have a corresponding procedure code. There are literally thousands of codes available, but the SBHS program utilizes 3 nursing codes, which are listed in the SBHS billing guide. Nursing professionals should ensure they have access to the current SBHS billing guide at all times in order to ensure they are using the most appropriate codes for the services they are providing. On this slide, we can see the 3 nursing codes utilized by the SBHS program. T1001, Nursing Assessment and Evaluation, should be used when billing for an annual IEP or IFSP evaluation or re-evaluation to determine if a student requires nursing services per their IEP or IFSP. T1002, RN services up to 15 minutes, and T1003, LPN services up to 15 minutes, should be used to record the daily nursing services provided to students who require nursing and health services per their IEP or IFSP. We will go over how to bill for these codes in more detail on the next few slides. As mentioned on the previous slide, ARNPs or RNs participating in the SBHS program should use T1001 when performing an annual evaluation as part of the IEP or IFSP process to determine if a student needs or continues to need nursing services as a related service in the IEP or IFSP. Please note that only ARNPs and RNs can use this code. LPNs should not be billing for the T1001 code. The T1001 code is untimed, meaning that no matter how long the evaluation takes, the ARNP or RN will bill 1 unit per day per student. There are no limits as to how many times this code can be billed per year. This means if the nurse needs to evaluate a student more than once per year, Medicaid will pay as long as there are treatment notes and an evaluation report to validate the paid claims. The T1001 code can only be billed if an evaluation results in an IEP or IFSP that include nursing and health services. In addition to the T1001 evaluation code, the SBHS program allows two codes which nursing professionals will use when providing direct services to a student per their IEP or IFSP. ARNPs and RNs will use code T1002 for services they provide themselves or for delegated nursing services provided by non-licensed school staff. LPNs will use code T1003 for services they provide. Please note that if you see a student multiple times in one day, a separate treatment note is required for each encounter, and the time in and time out must be recorded for each encounter. This ensures that the correct number of units is submitted for reimbursement. In addition, a minimum of 8 minutes must be provided in order to bill for 1 unit. As mentioned on the last slide, a minimum of 8 minutes of services must be provided by the nursing professional in order to bill for 1 unit of codes T1002 and T1003. If the nursing professional only sees a student once per day for less than 8 minutes, the nursing professional would not be able to bill for that service. However, if the nursing professional sees the same student multiple times throughout the day, the nurse should keep treatment notes for each time they provide services throughout the day to determine the number of total billable units for the day. We will take a look at this in the examples on the next few slides. As we can see on this slide, the nurse provides a total of 40 minutes of services to the student throughout the school day. The correct number of units billed is 3 units. As we can see on this slide, Joseph receives medication on a daily basis from either the school nurse or a paraeducator. On Monday, Joseph only sees the nurse for 5 minutes. This time is not billable as it is less than 8 minutes. If you recall, 8 minutes of service must be provided in order to bill for 1 unit. On Tuesday, Joseph sees the nurse twice for a total of 15 minutes. On Tuesday, the nurse can bill for 15 minutes or 1 unit of code T1002. On both Wednesday and Thursday, Joseph again receives at least 15 minutes of services, so the nurse can bill for 1 unit for each of those days. On Friday, Joseph sees the nurse from 9 to 9:15 for his medication, but also returns to the nurse in the afternoon for treatment of a scraped knee. The nurse will still only bill for 1 unit of service for the medication administration. The emergency care provided from 1 to 1:15 is not billable as this is not an IEP service. In this example, we see that Johnny's IEP states that he requires nursing services 45 minutes 4 times a day. To calculate the billing units for these nursing services, the nurse must keep track of the time in and time out for the services provided to Johnny for each school day and divide by 15 to convert to billable units of service per day. Please note that if your district contracts with a third-party biller, the units may be automatically calculated in the electronic treatment note system. In this example, the nurse would submit a claim for 12 units per day. In this example, we see that Maria's IEP states that she requires 420 minutes of nursing services every day. 420 minutes a day is equivalent to 8 hours. Although this child may require all-day nursing services, the SBHS program will not pay for continuous observation of a child when direct healthcare services are not provided. To calculate the billing units for nursing services, the nurse must keep track of time in and time out for the services provided to the student for each school day and divide by 15 to convert to billable units of service. If you've worked in a hospital or clinic setting, you know that in addition to procedure codes, each procedure also requires a diagnosis code in order for insurance to pay. The SBHS program utilizes one diagnosis code, R69, which stands for Illness Unspecified. As a provider participating in the SBHS program, you don't really need to worry about this, as this information is entered on the claim in Provider 1 by either the district's Medicaid coordinator or the district's third-party biller. You do not need to record the diagnosis code on your treatment notes. However, I just wanted to provide this information as a reference. Your school district may have additional time limits for when treatment notes are due. However, Medicaid's time limit for SBHS providers to submit claims are outlined on this slide. Providers must submit the initial claim to Healthcare Authority within 365 calendar days from the date of service. Within 24 months of the date of service, a provider may resubmit, modify, or adjust an initial claim that was assigned a transaction control number. Claim submission is typically done by your district's Medicaid coordinator or your district's third-party biller. Documentation requirements. When participating in the SBHS program, providers must follow Medicaid documentation requirements, which requires providers to keep detailed treatment notes that justify all billed claims. Treatment notes may be kept in electronic or handwritten format. Treatment notes must be maintained for 6 years from the date of service. Treatment notes must contain the following information: the student's name, the student's date of birth, student's Medicaid Provider 1 ID, the date of service, and for each date of service, the time in and time out, the procedure code, a description of the service provided, child's progress to each service, and a note whether the service was individual or group therapy. Notes must be authenticated by the provider who performed the services with either a handwritten or electronic signature. So what does this look like in practice? Some districts contract with an outside billing agent or third-party biller who assists the district with submitting Medicaid claims. If your school district contracts with a billing agent, you may keep your treatment notes in whatever software the billing agent uses, or you may keep your notes in another system approved by the school district. As mentioned previously, supervising ARNPs and RNs must review and sign off on any treatment notes kept by LPNs and non-licensed school staff. This can easily be done within the electronic documentation software. After the treatment notes are reviewed and signed, the third-party biller uploads the information as a billable claim into the Provider 1 system. The process is similar if your school district self-bills. With self-billing school districts, it is recommended that each provider within the district keep their treatment notes in a template, either handwritten or electronic, to ensure that Medicaid documentation requirements are met and to ensure that the person who is entering the information into the Provider 1 system has all the relevant information needed. Telemedicine. Telemedicine is when a healthcare provider uses HIPAA-compliant, interactive, real-time audio and video telecommunications to deliver covered services that are within the provider's scope of practice to a student at a site other than the site where the provider is located. As a school-based provider, you may be asked to provide services through telemedicine at one point or another. On these next few slides, we will review documentation requirements and other important information as it relates to telemedicine service delivery. The SBHS program pays for nursing evaluations, code T1001, when provided through HIPAA-compliant audiovisual telemedicine platforms, as well as through audio-only telemedicine platforms, i.e. telephone service delivery. Direct nursing services, code T1002 and T1003, are not reimbursable when provided through telemedicine. In addition to the documentation requirements outlined in the SBHS billing guide and in slides 34 through 37 of this training, when providing services through telemedicine, nursing professionals must also document the location of the student, the location of the provider, and the type of platform used. Depending on the treatment note template you are using, documenting this information may be as simple as choosing the correct dropdown or clicking a box. If your district keeps handwritten treatment notes, you may need to handwrite this information into the treatment note, depending on what your treatment note template looks like. Resources. As a nursing professional participating in the SBHS program, there are multiple resources available to you on the SBHS webpage at hca.wa.gov/SBHS. It is recommended that providers bookmark or save this page as a favorite. Resources for nursing professionals can be found under the Resources section and then under the Service Provider subsection. Under the Service Provider subsection, there are 3 columns titled SBHS Billing Information and Fee Schedules, Trainings and Webinars, and Additional Resources. Under the Billing Information column, providers will find a link to the SBHS Billing Guide and SBHS Fee Schedule. Under the Trainings and Webinars column, providers will find a PDF of today's training, as well as other trainings such as SBHS 101. Under the Additional Resources column, providers will find a link to the NPI registry, as well as a link to the Department of Health. At the very bottom of the webpage, providers can view past SBHS GovDelivery notifications, as well as sign up to receive SBHS GovDelivery notifications. SBHS program contact information can also be found at the bottom of the webpage. One resource available on the SBHS webpage is the SBHS Billing Guide. The SBHS Billing Guide is essentially the program manual for the SBHS program. The Billing Guide is intended to be used by school district administrators, SBHS Medicaid coordinators, as well as providers who participate in the program. The Billing Guide details how to bill correctly for SBHS services, including current billable codes, documentation requirements, how to bill for telemedicine, etc. The guide also lists SBHS covered services, non-covered services, information on program monitoring, eligible provider types, eligible students, etc. In most cases, answers to frequently asked questions can be found in the SBHS Billing Guide. A link to the current and past versions of the guide is available on the SBHS webpage. Providers may print out a copy of the guide. However, it is recommended the guide instead be accessed and viewed electronically. This ensures the provider is viewing the most recent version. In addition, there are active hyperlinks throughout the guide, which can only be accessed if viewing electronically. The SBHS program sends out email notifications via GovDelivery. Providers are encouraged to sign up to receive SBHS notifications to ensure they are kept up to date on program updates and changes. Providers can sign up to receive SBHS GovDelivery notifications by visiting the SBHS webpage and clicking on Sign Up for Email Notifications found at the bottom of the webpage. Providers may also view past program notifications by clicking on View Past Program Notifications. Please note that if you are trying to view past notifications on Google Chrome or Microsoft Edge, you will need to install an RSS feed extension in order to view the notifications. Directions on how to do so can also be found at the bottom of the webpage. We have gone over a lot of information on today's training. Just a reminder that all of the information found in today's training can be found in the current version of the SBHS Billing Guide. In addition, nursing professionals may find the additional links provided on this slide useful. This concludes the School-Based Healthcare Services Training, Billing for Nursing and Health Services. Any questions about today's training or the SBHS program may be directed to Shanna Muirhead, HCA's SBHS Program Manager, or to your district's SBHS Medicaid Coordinator. Thank you and have a great day.